I am Marwan Cameron, and this is the Conduit. All right, y'all, let's try this again. It is Monday, November 15th, 2021 in Kitsap County. 55 degrees, rain, wind, leaves. It's horrible. Terrible, or as Charles Barkley would say, it's terrible. I love fall, but I don't like losing power. I don't like tracking all the leaves into my house. It ain't cool, leaves, but they are pretty when they're dry and brown and red and yellow and oranges. That I enjoy. I just don't enjoy the nasty wet leaves and all the stuff that it brings in. That just drives me crazy. But it is Monday. I hope that you had a good weekend. As I was just saying, my weekend was not the greatest. My internet had a terminal error. I mean, terminal. And I could not figure out what was going on. Well, when you do a podcast, you kind of need the internet, right? So let's just say I had a stressful weekend, and that's why I had no shows this weekend. I had no internet. Literally, I went to a board meeting on Friday, and when I got home, I had no internet. It's like Friday afternoon, just all gone, right? And it literally took the entire weekend to get back to this point. And then, of course, I got this great idea. I'm about to install my new microphone here, which I'm excited to see how this thing works. Right, it's kind of an upgrade, studio upgrade to the Samsung Q9U. I might do reviews on some of my products at some point in time. Let people know what I use. But then it wasn't coming on, and it's like literally 60 seconds to showtime. So what did I end up doing? Trying to do something 60 seconds before showtime. I tried to connect a new microphone, which was an epic fail. So, it is what it is. We ride the wave. It is Monday, and on Mondays at 1 p.m., it is Kitsap Public Health Day. And so no one could come on from Kitsap Public Health today, but I think it's still important that we have a conversation as usual to talk about what's going on, all things COVID. So, as I shared with you last week, I did get my flu shot. And since I had an event last Friday, I didn't want to have any kind of ill feelings from getting the booster shot. I chose to wait and get the booster or get the booster, get the third shot this week. So I will be doing that sometime this week. Several people that have received the booster have reported to me that they did get a little ill after, where they just weren't feeling great. And so we have a lot of important shows this week. So I may wait until Thursday afternoon. I figure even if I'm not feeling the greatest on Friday, I can get through one show. But, I don't want to have to try to make it through the whole week not feeling great. So I will wait and I will get the booster shot. I had the Moderna, and so I'll get that booster this week, is the plan at this point in time. So, and of course, as I always do, I will report that information out to you. I may even go, like Facebook Live when I go, just so you can see, right? I think it's helpful for people to see, what's happening as people go and kind of navigate this healthcare system. So that is my intention. That is my plan. And, a couple things that I'm concerned about, and we can talk global first. And one is there are some other countries that are starting to see an increase in COVID. And we tend to lag a few weeks behind some of these other countries. So we're talking about some European countries. Um, but they're starting to have this increase, right? And even if they have high vaccination rates, right? We've got holidays, we have travel. As I was speaking with our nurse last week, we were sharing, or I shared my concerns with her that she shared, uh, that now that we are opening our borders back to international travel for many countries, that is a potential to see an increase, right, in COVID cases. And so, I quite frankly am concerned about that because, even if they have to be vaccinated and have a negative test, right, the kids do not have to be vaccinated. And so you have more people, you're going to have more exposure and more opportunity, um, to start spreading COVID. So, like I said, I'm concerned about it. We are coming into the holidays, and you can look at a graph, you can watch and see what we do in this country is, we have COVID, right? And we shut down, and people are upset about it, understandably. And then as soon as we kind of get the numbers under control, then we open everything back up. And then what happens is, all right, well, we've opened everything back up. Everyone gets back together, and it's usually around a holiday. So then you get a lot of folks together, and then here we go again, and we just go back down the same cycle. And it just keeps going and keeps going and keeps going. And so that part is really frustrating to me. And so while, we're looking at our economy and inflation and housing and all these really critical uh, issues in our country, I just feel like if we could really get a hold of this thing, we could get to a point where we're not going through that kind of yo-yo, right? So we just had Halloween. This is a 2-week lag right now, so it is literally right the middle of the month. So we may start to see COVID increase. So we'll have to take a look and see how that goes. So next week we'll have a better idea of that because now you've got that 2-week window, and of course we've got Thanksgiving coming up here really soon, and so you've got folks flying and meeting together. It's getting colder, it's getting wetter, so a lot more people are staying indoors, right? But our restaurants are open and things like that. So, just to me, very concerned about that. Definitely need to be diligent. We will talk about this on uh, at 3 o'clock with Jill and Matt from KCR and Bremerton Housing Authority. But as you know, or if you don't know, for those that don't know, we actually provide transportation here in the county. And to that end, we work with uh, disadvantaged populations and, folks that are experiencing homelessness and staying at shelters is part of who we serve, a big part. And so we got a call yesterday that the Salvation Army right now is in a lockdown because of a potential COVID, and so anyone new coming in needed to be diverted to some other places. So to motels. Well, let me tell you, right now, the Kitsap Rescue Mission is has a waiting list. Salvation Army obviously can't take anyone in because this is what happens when there's a COVID issue, and we during our transportation, which I think we transported more than 10 folks, um, the motels were getting filled up. So now there's no more available rooms, right? So exactly what are we going to do? And you may not see this as you're going to work. You may not see this as you are, a stay-at-home parent and taking care of business that way. You might not be cognizant of that going on, but that is the scenario. This is real, right? And again, there's just not a lot of spaces. I have folks today that are going to get their kids tested, because they've been exposed. And we know what a disruption that is. So when I think about Layla and the fact that Okay, you go to school, you learn. If you get a COVID scare, the kids get a COVID scare, and then you have to go home and quarantine for a certain amount of time, right? It is going to impact your learning, right? There's nothing like being in the classroom, but you need to be in a safe environment. And so I think about the loss of having the access to that teacher in that way, the challenges of, you know, computer literacy or having the requisite hardware. The fact that, she may not be able to ask questions and get answers, you know, quickly like she could when she raises her hand in the classroom. All these things are so impactful. And, all of our kids have already lost a year of virtual learning. To me, that's a huge issue. We don't want our kids to fall behind. This is a very competitive country in regards to opportunity. And while you were seeing opportunity, a lot of job openings right now, unfortunately, many of them are jobs and not careers, right? So you don't want your kids to fall behind. Again, another reason to stay safe. Make sure that you're wearing your mask, wash your hands often, make sure you're washing your mask. Um, we can get laxed a little bit. It's like, hey, I just leave my mask in my car and I put it on, every time I run in somewhere, you're probably gonna want to wash that mask and have a few different masks that you can rotate, right? That's a good idea. That's a really good idea. So please be diligent. But as we always do, oh, thank you there, Mr. Dent. I'm glad that I am looking and sounding good. Like I said, I might actually have to recreate the afternoon show because I launched that show and I'm like, I don't see anyone here. And I look up and it's like housing, like I'm in the wrong show. Well, it's Monday. Everything can't go perfect, right? Now there's so many shows right now. And let me tell you, we got some really awesome shows coming up. So a lot of planning going on. I mean, Conduit is continuing to grow, and got some good folks behind the scenes that are ready to, take it to the next level there. So, whoops, I meant to click on this one here. But again, it's always good to go to the Kitsap Public Health website. Again, kitsappublichealth.org. I put that was sitting up there for you to kind of take a note of. Go ahead and put that back on the screen for you. Interesting enough too, as we do these shows, there's things that I can front load and have them kind of already set up. Well, this list as the podcast grow gets so long, right? So you're trying to find this one little piece of information. You're like, where is that little chat link? So I've got to find it in here. But again, every week they update the latest and greatest as far as information here in the county. And so I'm just here at the homepage. And again, kitsappublichealth.org. And as Nurse Lindsay was sharing with us last week, right, we can just scroll down here looking for vaccination information for 5 to 11 years old. You can click here. Okay. If you're looking for a vaccine clinic update, we are offering appointments for a November 19 clinic for children 5 to 11. The link is here for you to register, kphd.timetap.com, for more information on their vaccination for children 5 to 11 page. Other providers may have appointments available for children ages 5 to 11. We recommend families start by contacting their child's regular healthcare provider to find out if they are offering vaccination prior to contacting other vaccine providers. See their provider list and or visit their vaccine locator, which is also really helpful. We are now requiring appointments for booster doses at our clinics. We will continue offering walk up availability for patients 12 and older who are not yet fully vaccinated and need primary doses, and for immunocompromised patients who need third doses. The calendar below shows locations and times where Kitsap Public Health District vaccine clinics are available. So if your clinic times or locations, if they don't work for you, there are some more vaccination sites available throughout the county. And so they have a really huge list here, which is really awesome. To view future clinic weeks, just click on the right arrow to look at future weeks. So, as we know, today is November 15. We're right in the middle of the week. And you can see here on Wednesday at 2 to 4, St. Michael's, Bremerton, they have the Moderna at 2520 Cherry Avenue. On Thursday from 3:30 to 5:30 p.m. at St. Michael's in Bremerton. They're going to have the Pfizer and the J&J at that same 2520 Cherry Avenue, and that's the old Harrison Hospital. And then on Friday, at the exact same place, they're going to have the Bremerton Pfizer for ages 5 to 11. Appointments are full on that day. So we can go into the next week here by clicking the arrow as they suggested, and that will let you know. So again, that next week, they have at St. Michael's in Bremerton the Pfizer for ages 5 to 11. So this week it's full. Next week it's open, and the week after that, and they will probably continue to add some more information here. But if you're out there at by North Point Church, which is down on 1779 Northeast Hostmark, out there in Polsbo, 11 to 1, you can receive the Pfizer. Okay. So just good information for you there. Sal says, good work, my brother. I appreciate you, sir. I appreciate our conversation earlier. What I'll say is, it's good to talk to other folks and get other perspectives. Sometimes we can, um, we can make decisions or think about things, and maybe they sound good. It might be two good choices, but you know, two good choices means they're probably a better choice. So thanks for helping me make the better choice today. All right. So again, back at the homepage, right? Remember, I just clicked on the calendar here, and what I love about this is just as you scroll down, they just made it here. So you don't even need to click. You can print it off if you need to, which is awesome. Okay. So you can book a vaccine appointment. You can find vaccination sites here. Little outreach tool, little fact sheet. And as you know, one of the reasons why we come on every Monday, as of November 3rd, everyone ages 5 or older is eligible for COVID-19 vaccination. Minors and those younger than 18 do need consent from a parent or guardian. And vaccination is available to everyone, regardless of immigration status. Okay. And you can learn more at covidvaccinewa.org. As they were saying earlier, there's a list of Kitsap providers for 5 to 11. And as suggested, talk with your primary doctor would be the first place that you should have that conversation. And just here, can I get a COVID-19 booster shot? As I shared before, I'll be getting mine probably Thursday evening, just so I can make it through the bulk of the shows this week, because there's a chance that I might not feel too great after. So I just want to make sure that I'm okay. And so just a lot of good information here. Just going to scroll down a little bit more. And when you scroll to the bottom, this is where you're going to get your updates. And so weekly updates are on Tuesday. And so the last update was November 9th. And so it looks like this will be, sorry about that. This will be updated tomorrow. Okay. And so you can get the latest and greatest. Now, tomorrow, I may actually talk a little bit about this just so you have those numbers. As I said before, there's about a 2 week lag. So we had Halloween, and now we're in the middle of the month. It may take another week for us to actually start to see what's happening, but if there's going to be any change, and predictably could be a slight increase, we'll see what that looks like. So, but as I said before, typically what ends up happening is, we open back up, everyone starts trying to resume their life as usual, and then the cases start to increase. We shut back down, and then it's rinse and repeat. And then holidays and big events tend to gather us all together, and boom, there you go. So I would love to be able to break that cycle at some point in time. So eligible Kitsap County residents vaccinated ages 5 and above. Okay. 70.1%. Here you can look at the total population initiating vaccine overall. Okay. And then the total population of fully vaccinated overall. So 58.8% and 54.5% respectively. They even have the Department of Defense here, which is interesting. Uh, and here, this is what I'm talking about. So here is the weekly doses administered to Kitsap County residents. Here you're looking at when folks are getting their first dose of the mRNA, and then when they get their second dose, and that's just kind of color coordinated there. You see the Johnson and Johnson. So you're looking at that. So you can see not a lot of activity was happening during, July and August, and it started to increase in September and now October, right? There was a big week there where people were getting that third booster, looks like, right? And now it's starting to come down a little bit. Scrolling down a little bit more, the Kitsap County vaccine distribution demographics. You can look at that by age group of how it was initiated. So all good information if you're curious, right? If you got a kiddo in school and they're a certain age, you can take a look at that. 65 and over. And then you can also look at the percentage of vaccinated Kitsap residents by region or age, right? So Bainbridge Island, 12 plus, 85%. So they are by far the most vaccinated by quite a bit. I think they deserve a horn for that. I think they deserve a horn for that. Bremerton and CK, 62%. North Kitsap, 72%. South Kitsap, 66%. And total Kitsap, 67%. So we're getting to that 70%, right? We're moving. We're trying to get there. But I live in Bremerton, so come on, Orange. Come on, Orange. We can do it. Percent of vaccinated Kitsap residents by eighth or by race, ethnicity, and age. And here again, you can see to the right here. So you have American Indian or Alaska Native is in the blue. Okay. And then Asian is in the orange, 55%. Black African American is at the bottom at 45%. Okay. And that's as of November 6th. So I'm hoping that these numbers increase. But in the percent increase in the past 2 weeks has been 1%. So that's pretty low. That's pretty low. Our Hispanic brothers and sisters are at 52%. Again, with a 1% increase over the past 2 weeks. Our white brothers and sisters have a 1% increase over the past 2 weeks. They're at 58%. And I wonder what's going on. Like, data is always exciting to look at, right? And you see the numbers are just, this is date, right? And then the percent of those vaccinated. So both of these things should be going up, right? But what was the catalyst here for Native Hawaiian and Pacific Islanders, right? They just shot up here as of November 1, right? Percent of those who have initiated the vaccination, and the percent increase in the past 2 weeks is 2%. and then here again, American Indian and Alaska Native. So is this, you know, this is what people will ask questions based on looking at charts and graphs, right? So were there events? Was this, was the vaccine more accessible? Were folks reaching out into the community? Were they, going to folks' houses and vaccinating them? Like, what, why was this? Did this jump kind of happen here? As you can see, everyone is kind of close, aside from American Indian and Alaska Native. They kind of just went straight up, like, right, and now they're starting to come down a little bit. But that was a super rocket. Everyone else kind of followed a very similar trajectory, but again, the Native Hawaiian and Pacific Islanders started following this trajectory and then just kind of took off in April and haven't looked back. So, that's something to take a look at. Why is that? Males and females, right? Our female population is vaccinated at a rate of about 72%, where our males lag behind 11 percentage points at 61%. So, all really good information here. And again, I haven't clicked once. I literally just scroll down on the site there. So really easy. Take you a few seconds. It's updated every week. Probably a good idea just to come in, Tuesday afternoon or even Wednesday morning with your coffee. I was saying your coffee and your paper. Like, who reads the paper anymore? At least not paper. They might be reading a digital copy of it, but how many people actually read the newspaper? That's an interesting question. I know uh, news companies have a hard time, right? Technology is the enemy in that regard, for sure. Let me see. Is there something else that I wanted to show you? I wonder how many of you have gotten your booster. Like I said, my plan is to go ahead and get mine here on Thursday. I like to kind of just go now. I hate, thinking of, man, I got to go get that shot. I got to go get that shot. It's like, let me just go and do it and get it over with. But like I said, I've got a pretty busy week. So I just want to make sure I can uh, keep doing all the things that I've responsible for, in case I get a little ill. So, and it's been my experience that a lot of folks have gotten a little sick, for a day or two from getting their booster. So, I'm just trying to prepare myself. And that was something that Nurse Lindsay and I were talking about last week, right? Have that conversation. Uh, where am I going for the booster? Well, that is an excellent question, Miss Christina. I am likely just to go down to Safeway. So that is where I get my prescriptions filled at. And they're pretty cool. I could go into my doctor and get it there. Uh, I could get it at Walmart if I wanted to go out and do a little shopping or smell some candles with Layla. But I think I'm just gonna go down to Safeway and just get it there. So I called them and just said call ahead, get put on the list. I'll go and get it done. No muss, no fuss. And then I'll treat myself to maybe some of their lobster bisque soup in the deli, which is one of my favorites. Of course, I'm not endorsing Safeway or anything. I mean, that just sounds kind of crazy. It's like, oh, Safeway soup. Oh, you need one too? Um, yeah, I mean, Safeway is not a bad one. For me, it's just, trying to go in there at a time when it's not crazy. So I definitely wouldn't recommend when folks are getting off work. It's a zoo in there or first thing in the morning or at lunchtime. But like if you can slip in there at like 10:30 or maybe even 11 a.m., I think they seem pretty slow in there, or around 8, you know, 8:30. I think they might take the last one because we called the Port Orchard Safeway, and I think it was 8:30 at night is when one of our folks had it done. So that wouldn't be a bad time to go. Anytime it's dead is that's the time you want to go, 'cause that just makes it just so much easier. Trying to see if there was any other information that I wanted to share with you on here. Oh, so this one is a big one. Um, the resources for community partners, the Vaccine Equity Collaborative. Uh, Kitsap Public Health has recently convened a collaborative of community organizations, residents, and healthcare providers to focus on improving equity in local vaccination efforts. If you would like more information or if you're interested in participating, please complete the brief questionnaire. For questions or more information, you can email or call Holly Ballstead at holly.ballstead at kitsappublichealth.org, or you can call 360-233-6247. Again, that email is HOLLY.BOLSTAD at kitsappublichealth.org, or you can give Holly Bolstead a call at 360-233-6247. Rob says my mom does. Yeah, absolutely. So I will tell you that our organization is one of the community organizers that does participate in the Vaccine Equity Collaborative. So again, it's about having your voice heard, right? And so as these organizations are trying to be more inclusive, our part is to actually show up and then let them know how we feel. Um, because if we want change, they're not mind readers. So it is up to us to go and do the avocation when they are actually reaching out in that way. So super, super important. Definitely encourage you to do it. Be good if more organizations do it. And then, uh, folks actually commit to doing that work of making things more equitable, because there is a difference between um, meeting together and pretending like you're doing the work, but actually doing meaningful work. So, but that is the first step. You got to do the first step. And then after you do that, you can continue to move forward. Just some other things on Kids at Public Health. Community health. You can look at communicable diseases, health services, insurance. If there's any garbage or septic issues, you can look at that. Streams, lakes, and shellfish. I'm not much of a fisher uh, or doing things like that, but like tide water things, like I'll see that uh, that'll come through on a text from me saying, "Oh, this is what's going here," like red tide or whatever that stuff is. So, food safety at home, temporary food vendors, food recall issues, all kinds of different things you can check on. Reporting of foodborne illness. Again, if you get sick from eating at a restaurant, or you buy something like, let's say, some lettuce, and you get sick, definitely report these things out, because the faster they can nail down where this came from, the more people that won't have to go through that pain and discomfort that you went through. So everything here: bad weather, bed bugs, birth certificates and death certificates. There's a lot of stuff on here: lice, lead resources, mold, permits, and status, school safety, rodents. So I think sometimes you know we don't need this information at the time. So it's like, but all of a sudden something happens. It's like, well, who do I call? So we're talking about vaccination today, but Kids at Public Health website is laid out pretty well. It's really pretty easy. Want to get involved? There's even careers here which you could click on. Not going to worry about that today. The big thing was just giving you some vaccine information today. So again, you don't even have to click. I just scroll down. I can see the times that the vaccine is being offered this week. First one on Wednesday, the 17th at 2 p.m. at St. Michael's, and then Thursday at 3:30 p.m. And then Friday is already booked. So you'd have to go to that next Friday, and you can just click that arrow there, right? It's updated about every Tuesday. You can book your vaccine appointment. You can find other local vaccine sites. So, And Christina's like, oh, I wonder where there's a walk-in. She can go ahead and click here at the find local vaccine sites right there. If you're looking for more information, all of that info is right here for you. Nice little fact sheet. Maybe I'll click on that. Right. And this is just a fact sheet for kids 5 to 11. So as that information is getting out to everyone, that kids 5 to 11 can become vaccinated. These are going to ask some, answer some very common questions, right? Vaccine is available, it's free, and insurance is not required, right? That's a big piece of information there. Patients receive 2 doses, 3 weeks apart. Children 5 to 11 receive a smaller dose than older patients, but it's the exact same medicine, right? They just put it in a smaller vial. So they're not getting anything different. Side effects are typically mild and go away within 1 to 2 days, which is why I'm waiting till Thursday. More severe reactions have occurred, but they are rare. And if you want to learn more, you can go to the cdc.gov/COVID-19. All right. And then Kitsap providers ordering vaccine for children 5 to 11. That list is current as of last week on the 3rd. And then to check for updates, that website is kcow.us/vaccine. And again, that's where I'm at right now. So let me go ahead and just pop that in the chat. That's what I was trying to give to you earlier. That's literally where we're at. And so you can see all of these providers all over Kitsap County that has this vaccine available. So everything from the Bainbridge Island Community Pharmacy, the Fred Meyer Pharmacy in both Bremerton and Port Orchard, Kaiser in Silverdale, Franciscan Medical in Port Orchard, the Member Plus Family Health in Bainbridge Island, Pacifica Medicine and Wellness in Poulsbo, Silverdale Pediatrics in Silverdale, and there's multiple doctors' clinics, multiple Walgreens, and Walmarts. So again, there's a ton. If you don't have internet access and would like additional support registering for a vaccination appointment, you could just give Kitsap Public Health a call and they'll set it up for you. 360-728-2219. For Spanish, 360-728-2218. Okay. And if you want to learn more about COVID or coronavirus, cdc.gov, again, /coronavirus, the main website. And you, again, can also call that main number 360-728-2219. And they will definitely point you in the right direction, if not just answer your questions for you, which is awesome. So I hope this was helpful for you today on a Monday. It's always helpful for me to take a look at the numbers, see what's going on. We're getting there, but 1% over the last 2 weeks. We could do better. We could do better. We could do it. Let's do it. I'm going to get my booster. I'm going to try to add to that 1%. Hopefully you will too. But we will be back next Monday with another show where we talk about all things vaccine and COVID. If you do have questions, please reach out. You can reach out in any of the different manners that we share with you, whether you leave a chat, whether you give us a call, whether you contact Holly Balstead directly, they will reach out to you. Okay. And again, when they're on the show, if it's not a pressing question, but we want to answer it as soon as possible, we'll answer it right on the show. So, because again, we're live. So if you have a question, go ahead and pop it in there. And the cool thing is typically if you have a question and you ask it, it's likely that several other people have that same question. So you're doing the community a favor by asking it. All right, guys. I am Marwan Cameron. This is the Conduit. I will be back at 3 p.m. with Jill Stanton from Bremerton Housing Authority and Matt Garrett from KCR. All right, until then.